So really making sure that we continue to impress upon New Yorkers the need to follow our core four, wearing a mask, staying 6 feet apart, washing our hands, and staying home if we're sick, or if you can, and then also getting tested. We are certainly in the midst of a holiday season, and so also avoiding travel and non-essential activities are also all very important. And so I do want to just say that at the forefront, to make sure that as we are thinking about this vaccine, that there are other steps that we can take. So to address the matter at hand and to provide sort of a situational awareness around the vaccines. So, many people know that as of Friday, December 11th, the Food and Drug Administration issued an emergency use authorization approval for the Pfizer vaccine, which did give us the opportunity to begin administering vaccines in New York City and across the country. Pfizer began shipping the vaccines to healthcare facilities on Sunday. We received vaccines as early as Monday, and they went straight to our healthcare facilities who are responsible for receiving and storing the vaccine. We have been working with our healthcare facilities to make sure that they have all the resources that they need, and that's both our public health hospital system as well as our independent hospitals, making sure that they have the freezers that are needed, since Pfizer does require storage at -70 Celsius. And so really making sure that we have that in place and have been working on them for quite some time. So that's the Pfizer vaccine. And then we expect very soon, you may know that the Independent Advisory Board yesterday reviewed the science and data around the Moderna vaccine. And so we hope that in the next day or two, we'll receive another emergency use authorization approval for the Moderna vaccine. Just so you know, and I'm sure the next speaker is going to talk about this as well, but both Pfizer and Moderna vaccines are mRNA vaccines. And so they do not contain the live virus. Just to be very clear, the vaccines are, you can think of them as an email. The message of that email is in the vaccine itself. And once injected, it is actually injecting a protein particle, the genetic material of a protein particle that is consistent with the protein particle on a novel coronavirus, SARS-CoV-2, that allows the body to recognize that protein particle, replicate it, and then once the protein particle is in the body, it will then mount a response to that pathogen or to that foreign particle. And so that will allow your body to then have the antibodies to make sure that you will then have the immunity. Now, both Pfizer and Moderna are 2 doses. It is a series. And so the first dose only confers only 50% immunity. And so it's really important that we stress that you have to take both doses to reach the 95% immunity. Both Pfizer and Moderna have similar immunity protection. The storage is a little bit different. As I mentioned, Pfizer is required at -70, whereas Moderna does not require -70 storage, and so the storage capacity will be different. The other thing to note is that the Pfizer vaccine, the second dose can be administered as early as after 3 weeks of the first dose, whereas the Moderna vaccine is 4 weeks. And so really important that, yes, we want to address hesitancy and really make sure that people understand the data, but then also once after they take the first dose, it's also taken the second dose. Important to note that the vaccines will not initially be available for children, anyone under the age of 16. The approval for emergency use has only been approved for individuals at the age of 16 and older. So thinking about children in New York City will have to be for a later date, as most trials have not been done in children. Just to talk quickly about the distribution plan. So we know that there's a limited supply of vaccines that are available. As of right now, today, December 18th, we have about 43,000 doses in New York City. As I mentioned, Pfizer shipped those vaccines directly to the healthcare facilities. And so the hospitals are working to vaccinate and administer those vaccines to healthcare staff who are in high-risk duty. So intensive care units, emergency departments, really making sure that they are getting vaccinated. The other group in this phase 1A is also staff and residents at the long-term care facilities, thinking about nursing homes. And so those are also important. As we get another allocation, particularly within the Pfizer dose, the Pfizer allocation, we will then begin to look at some of the other high-risk groups for healthcare workers, as well as first responders as well. And as we then get additional allocations, as well as hopefully in the next couple of days, additional recommendations on priority groups from the federal government, then we will hear how they will roll out to additional groups. Those additional groups include essential workers, and we've been working on the state with how do we categorize essential workers, 2, older adults over the age of 65, and 3, individuals with underlying chronic illness. And so that will really round out sort of the categories in the first phase, since there will be limited supply. And obviously, thinking through that prioritization process is an active discussion now, but we're still waiting for guidance from the federal and the state government. In mid-2021 is when we think we will have doses that will be more widely available for the public. So that's when we'll move into phase 2 of our vaccine distribution plan, when we're sort of thinking about more of the general public, increasing access points, making sure that we're really working with all the ways that people get their vaccines now: pharmacies, primary care providers, urgent care centers, community clinics, but also thinking about leveraging our test and trace apparatus, because we've already done a lot of work to really increase our testing resources in the city, but also thinking about community centers and working with faith leaders, houses of worship, to really make sure that there are additional points for New Yorkers. And then sort of our phase 3 is sort of thinking about how we would integrate this into our routine vaccine schedule. So that's much further, but just to give you sort of a top line, sort of how we are thinking about this. Just finally, let me just say that I have been looking at the data and truly, I trust the vaccines, that they are safe. I am certainly, when the time comes, preparing myself to take the vaccine, and certainly think that is important as a public health leader in the city. Just a message how I've been really looking at this and want to get out front. But certainly when that time comes, I will make sure that New Yorkers know. But we're working to ensure that we minimize any and all barriers. The vaccines are going to be free, no cost to New Yorkers. Your health insurance may be billed, but no New Yorker should be charged a copay or any type of fee at all. We have already been working to develop our vaccine equity strategy plan that is going to also sort of be in lockstep with our overall vaccine distribution plan. And so we have not posted it, but it is concrete and thinking about the ways that we want to make sure we're prioritizing New Yorkers, our priority communities, as well as the vulnerable. And so certainly we'll be looking to share that with this group very soon. We've been getting out some information, and so some of the things that I've shared are publicly available, can be found on our website at nyc.gov/COVID vaccine. And with that, I will end there, and hopefully I can take some questions.
Yeah, thank you so much, Dr. Easterling. We'll get to the question and answer portion definitely later on in the program. Next up, we'll have Dr. Raju, who is the former CEO and president of HHC. Dr. Raju.
Oh, thank you very much. Can you hear me now?
Yes, go right ahead.
Oh, good. Okay. And again, thank you for letting me participate in this very important event. And I really want to thank the Borough President and the elected leaders and clergy for taking this an important step ahead. My background is about last 20 years, right? I have been understanding and trying to fight for health equity across the country. So I worked on vulnerable populations and I led two largest public systems in the country. I was a president and CEO of Cook County Health and Hospital System in Chicago. Then I was the president and CEO of New York City Health and Hospital Corporation, which runs the public system. So I have a tremendous amount of interest and I've been fighting for health equity and eliminate disparities in that. What we are facing right now in our country, it is something we've never seen before, right? So the entire population is suffering from it. And if you really want to go back to normalcy, that means you're going back to what we were doing pre-COVID, then the only way that will happen is at least 80% of the population develop antibodies to it. There are two ways you can develop antibodies. One way is, right, you can get infected and then survive the infection, then you get antibodies. The other one is get a vaccination. The first method of doing getting infected has got, of course, a lot of risk. And also the healthcare systems in this country simply cannot be able to take care of 80% of our population at any particular time. We are not equipped for that. So we have to depend on the vaccination to get back to what we are doing, opening up the schools to the full time, opening up the businesses, and people are able to go out and they mingle and you see the families and enjoy themselves. All those things depends on how quickly you are able to get the immunity, and a major portion of it is the vaccine. There's a lot of concerns regarding vaccine because people say, wait a minute, I take the flu vaccine, I got flu anyway. This is very different because the flu vaccine, basically what we do is we look at the virus which causes flu in the southern hemisphere, because at the time when we are in winter, they are in summer. And they are in winter, we are in summer. So during the summer, we look at the southern hemisphere, which is South America, Australia, New Zealand, and see what is the virus which is causing the flu. And then we basically include that in our flu vaccine. So it is basically a guesswork. This is the bacteria will come. This is the virus will come in. That is why the flu vaccines are sometimes about 50 or 60%. But COVID is different. This vaccination was tried and worked against COVID virus. So this is not a hit and run. Maybe this will work, it will not work. That is why you are seeing 95% effectivity in both Moderna and Pfizer vaccine. And the other vaccines are coming very close. Merck is developing one, AstraZeneca is developing a vaccine, as well as Johnson & Johnson developing a vaccine. So we are going to have a multiple variety of vaccines. But we are, as Easterling talked about it, we have to know something. What we are injecting is not a live virus. So you cannot get COVID by taking a vaccination. That is the first thing. You will not get COVID just by taking the vaccination, because what we are injecting is not the virus. It is basically a messenger RNA. It is a small signaling system inside the virus. So we are basically injecting it. So the body is duped, thinking that it's getting the virus, whereas it's not getting the virus. It's getting a messenger RNA, which is a small portion of messenger. So it starts creating antibodies. So 4 weeks or 3 weeks later, depending on the different vaccination, next time you inject that, immediately body responds with more antibodies. And that is where you get the protection of that. So you have to be protected only if you take both number first dose and second dose. So people just taking the first dose and then not taking the second dose is not good. So we have to take both of them at the same time. One of the things we have seen repeatedly, which is nothing new to this population, which our group today, because of the health inequity in this country, right? The people of color and people, black and brown people, got more affected by the coronavirus, and they become more likely to be hospitalized, and they have a higher mortality rate compared to the white population. Right? That is why it is so important that we have to convince the people who are more vulnerable to get the vaccine as quickly as possible, because that is, we want to really protect them, making sure that that kind of health inequity does not carry on in our system, right? So the vaccination is helpful. It'll get you where you want to get into that. And one more thing is that once you start with the Pfizer vaccine, you have to take the second dose of Pfizer vaccine. You cannot mix and match. You cannot take the Pfizer vaccine this time and next time you take the Moderna vaccine. So you've got to be both at the same time, right? The Moderna vaccine, which is going to be approved in the next probably 24 to 48 hours, is advantages that it can be stored in a regular refrigerator. So it makes it easier to store this and be able to give it, as opposed to Pfizer, which needs the special freezer boxes where we need to be stored. So there is a lot of worry about the vaccination, in this country, because of a lot of people think that I don't need the vaccination. This doesn't help. It actually makes it worse. This is not, COVID is not such that. COVID is a pandemic. It is really having a lot of issues for us, both economically, socially, as well as medically. So we have to do something to really combat the disease and come out good on the other end. So that's a very important aspect of it. So we have to really embrace this vaccination and be able to deal with that. Again, this is not a live vaccine. This is not we are not injecting live virus into people and producing a vaccination, because people always get worried about Tuskegee trials. Oh God, they injected everything and gave people syphilis. No, this is not a live vaccine. This is a messaging part of the vaccine, which we inject to dupe into to make the system dupe, thinking they're getting virus, but they're not getting virus. That's why he's making it part of it. You're going to have some symptoms as a part of vaccination. Some people develop a little feverish. They feel a little down as a part of it. Actually, that is good. That means the body is recognizing and reacting to it. So they will not get a full-blown fever or full-blown COVID. They may have a little symptoms here and there, as a little bit of pain at the site where you get the vaccination, or it could be that you feel a little feverish, you may feel a little, down, little lethargic, or you're a little tired. That's all perfectly normal. That's what actually tells you that your body is reacting to it, that you are developing antibodies to it. That is the best way to do that. One of the questions which keep coming up is, if you already had a COVID and I survived it, I am supposed to have my antibodies. Why do I need a vaccine? The reason you need a vaccine is because the antibodies you develop is not neutralizing antibodies. These are not the antibodies which will help you if you get another COVID virus, right? Whereas this one will protect you against another COVID infection and then make sure it's all right. It is also pretty safe. It has been tested all over the place, so that it's very safe. And as Dr. Easterling said, pregnant women and children, we have not tested it. So at the present time, we are not encouraging them, we're not letting them take this vaccine. But the people who have got disease, people always worry, I have diabetes, should I take the vaccine? Yes, you should, because you are a high risk for developing COVID. So you need to take that. I'm immunosuppressed. I had a chemotherapy. I had a cancer medication. Should I take it? Yes, you should take it, because again, you are a high risk for COVID. So we need, the people like you, the clergy, the political leaders, the elected leaders, the people who are trust leaders. These are people who the community trusts to do that, should be leading this charge, because this is the only way we are going to come ahead of COVID, so that we will go back to the normal way we lived before COVID came in, the normal, vibrant New York City, where we really able to do things we want to do. And that's what we are trying to do. So we are, as they called it, this is the beginning of the end. Hopefully we get everybody vaccinated by middle of next year, and we develop enough herd immunity. 80% of the people have got antibodies already in the body. So we completely squash the virus at the end of the day. So thank you again for doing what you do. And your role is extremely, extremely important, because you are the trust leaders. You are the people who the community trusts as a part of it. Though the doctors come and tell you these things, but you are the one who are trusted. So the elected leaders, the borough president who leads this as an important person to do that, and the clergy and the people who really do that, to be able to take this on and lead by example, that this is the way we are going to come ahead of the virus. Thank you for this opportunity. And I am, as a pastor wants me, I will answer any questions at the end of it, but I'll turn it back to the pastor. Thank you, sir.
No problem. Thank you so much, Dr. Raju, and we'll definitely come to some questions. You can put your questions in the inbox as well. Let me bring on Borough President Eric Adams to give us a few words, and then we'll go back to one or two speakers, and then we'll try to answer your questions. Borough President Eric Adams, good morning.
Thank you, Pastor, and thank you to both our doctors for just their accessibility. The number of times I've called them to get answers as this virus and really health issues evolve in our city. They have always been extremely supportive, and I cannot thank them enough. They're true public servants, and again, I want to just really commend you for your assistance. And that's the goal today. My goal is to pass facts, not fear. And when you utilize credible messengers like our faith-based institutions, our leaders of senior centers, adult daycares, civic block associations, this is how we get the message out. And we want to continue to ensure that as we start the process of using the vaccines, that we have the right pathway to get it to everyday people using our pre-existing census networks that are in place, as well as ensuring that as our faith-based leaders talk from their houses of worship, that we can give people real, credible information so they can make the educated decision on how they want to move forward. And so ask the questions that you are looking to get answers for. And as we move forward to really defeat COVID-19 and how it has impacted our lives. So again, thank you for coming on to both my doctors and Pastor Morose for continuing to organize this important initiative in our city. Thank you very much.
Thank you so much. Thank you, Borough President. All right, so we have a few questions in the chat box, and we want to get to those. Before we do so, we just want to hear quickly from some of our elected officials who have joined on with Borough Hall to make sure that this goes through correctly. And I will have now Assembly Member Joanne Simon, and then Assembly Member State Senator Brian Cavanaugh.
So thank you very much. First, I'd like to thank the Borough President and Pastor Monrose, and also Dr. Raju and Dr. Easterling for really powerful presentations that were really very helpful. A lot of my questions were answered from your presentation, and there are questions that I know that my constituents will have as well. We are in our offices, and I can't speak for Senator Cavanaugh, but I believe he probably is too, getting lots of emails from people who are very frightened about vaccine, or people who have taken positions that were against vaccines because of their concerns about the reports of children getting autism and things like that. And there are a lot of parents who are very worried about vaccination generally, and they don't see a difference. So it was very helpful to hear how the COVID vaccine is different from others. And I just want to say that I know that our offices will want to be working with you. My office will want to be working with you to get more information and to help us figure out how we can, within our own district, for example, identify people who may be more at risk, that we can filter into that system when you're talking about how to distribute it. We'd like to partner with you and work closely with you to get the message out to those people that really need to hear that message and help facilitate their getting the vaccine when the distribution plan comes around to them. We have a lot of people, a lot of seniors, obviously, in our districts. We know that public housing has been very badly affected by the spread of COVID, and we want to make sure that we're able to get this information and these vaccines to the people who need them most as quickly as possible. So I just want to thank you again for the wonderful information and for pulling together this program. And I'm looking forward to hearing other people's questions and those answers. Thank you so much. And please don't hesitate to call on my office at all as we go forward. Thank you.
Thank you so much. State Senator Brian Cavanaugh.
Thank you so much. First of all, I just want to begin by thanking our great Borough President Eric Adams for bringing us all together. There have been several very significant moments where he has use the convening power of the Borough President's Office to bring together, leaders of all kinds on important issues, and this is one of them, and I really appreciate that. And also, of course, to Pastor Monroe's and our doctors, Easterling and Raju, for their terrific presentations. The distribution of this COVID-19 vaccine really marks an important turning point in our battle against this terrible threat to our health and well-being. In a crisis where I think people have more or less had to think about just minimizing risk and kind of laying low, and kind of there haven't been as many proactive steps we can take. This is a big moment. Having said that, the effectiveness of this approach is going to depend on public confidence. It's going to depend on getting lots of information out to people so they can make informed choices about their personal decision to take the vaccine. It's unfortunate, in my view, that President Trump decided to call this Operation Warp Speed, which sounds like some mysterious process where you zoom ahead from one place to another. This, of course, has been a tremendous effort by our scientific and pharmaceutical community, and lots of experts, including the doctors on this call and Dr. Anthony Fauci, really have provided great guidance. It is a testament to the advancement of our medical community and science. We've learned so much from creating vaccines for SARS and MERS and the other outbreaks of disease in recent years, that it's a remarkable achievement that we do have a vaccine, several vaccines now that are looking like they're going to be a big help. I just want to emphasize that we got to continue to work together on this. We got to continue to build public confidence. As my great colleague, Assemblymember Joanne Simon noted, there are people that sort of carry around a skepticism of vaccines in general. We will, need to overcome that. And lastly, of course, I just want to say that, faith leaders play a terrific role in so many areas of life. But, the role of faith leaders in this group in working through the concerns and fears of people in the community and sharing their wisdom and moral clarity really is going to be an important part of this. So thank you to all the faith leaders that are joining this effort.
Thank you so much again, Senator. I just want to, we're going to some questions right now. Ryan Lynch, our Chief of Staff, is going to help us with the questions. And so I want to recognize Assembly Member-elect Stephanie Zinnerman, who is with us, and also District Leader Josh Pierre, who have also joined us as well this morning. Please keep those who have been coming on in terms of the leadership. Their office is always available if you live in their district or they represent you. Of course, you can always reach out to those offices to support. Questions, I'm going to have Ryan Lynch, our Chief of Staff, ask the first couple of questions. Is Dr. Easterling is on still? And we have Dr. Raju as well.
Thanks, Pastor, and thanks everyone for joining on behalf of Borough President Adams again. First question is that since children will not receive a vaccine, will there be any risk of them getting symptoms of this virus from vaccinated adults as a result of any vaccine side effects?
So far, what we have tested, right, when we did the test population, when that were tested, the children around them did not get any symptoms or any disease as a part of it. Again, I want to clarify the reason we are not at the present time advising children and pregnant women, and also people who plan to get pregnant, right? We do not, because we have not done enough studies on them to attest to its efficacy. We know it is very safe and efficacious in a major population, adult population. But as the research goes on, as more people are getting tested, right, and then we will be able to say it can also be extended to the children.
Thanks, Dr. Raju. I know that this first vaccine that's been rolled out, there's a second dose. What's the timeline for the second dose for both vaccines?
Dr. Easterling talked about it. The Pfizer is 3 weeks and Moderna is 4 weeks.
So that's, I'm sorry, can you say that again? It's after the first,
no. After the first vaccine, if you get a Pfizer vaccine, after the first vaccine, you get it in 3 weeks, the gap. If it's a Moderna vaccine, which is going to be approved in the next, hopefully 48 hours, hopefully, there'll be 4 weeks between the two doses.
Thank you. The next question is, by the time the vaccine is widely available, will there have been research on how safe it will be for pregnant and breastfeeding women to take?
Answer is yes, absolutely.
Okay. If you've already been tested for having the antibodies, is it still necessary to take the vaccine?
Yes, that's what I was talking about. The fact is, just because you had an infection and develop antibodies does not mean that you will not get reinfected with COVID, because the type of antibodies you develop are very different than the type of antibodies to develop when you get vaccinated. That is much more effective in 95% of the cases. So that is why we advise people who really had COVID infection should get this vaccination.
Thanks, Dr. Raju. Can you be more specific about what constitutes underlying health conditions? For example, does cardiac arrhythmias without underlying CAD fall into this category? Are vaccines safe for people living with HIV/AIDS or on HIV medications? And what about people with rheumatoid arthritis who are receiving infusions?
The answer is, again, all the vulnerable populations are important, right? That they need to be covered by the vaccination. If you are any individual specific people, then they need to consult with their primary care doctor, which is important, because some of them may be on a unique situation. Nothing is same for medicine everywhere. So there may be some individual circumstances where if you are in doubt, you should just talk to your primary care doctor. But in general, people who got a chronic disease, diabetes, high blood pressure, asthma, people who got, or people who are immunosuppressed, all those people will be benefited by the vaccination.
Thanks, Dr. Raju. The next question is, if you don't get a reaction, does that imply that your immune system is not responding to the vaccine?
No, it is not. That means your body is able to manage it better. It doesn't, not all bodies produce the same symptoms. So it simply means that your body is developing immunity, but is not showing any kind of fever or lethargy or tiredness or any of those symptoms. That doesn't mean that you're not developing immunity. It is because the body is reacting differently.
Great, thank you. We spoke about the vaccine safety for women who are pregnant or breastfeeding. What about women who want to get pregnant?
No, I think, no, this at the time of vaccination or in between vaccinations, we have to be careful. If somebody is getting, pregnant after the vaccination, it is okay. You have to get the vaccination. But during the period of vaccination, we have not done any studies yet. How does it affect the children? So till the studies are out, I think that's what we are holding off in vaccinating pregnant women at the present time.
Thank you. That's important. Appreciate that feedback. How will the demographic of under 16 individuals not getting the vaccine affect herd immunity?
No, the issue will be, it will not, because we will be, as soon as the studies come out that is safe for people under the age of 16, then we will probably start vaccinating them. So it is in phases, as Dr. Easterling was very eloquently talked about how we're doing it in phases. By the time it came to phase 3, we will have, I hope we will have enough studies showing the safety of this vaccination. We know its efficacy. It is very, very effective, but we just want to make sure it's safe. That is the only reason we're waiting for. I'm pretty sure by the time the stage 3 comes in, right, we'll have enough information so we can proceed with that.
Great. What's the biggest difference between the two vaccines other than the timeline between the first and second dose?
I know whether Dr. Easterling I don't want really, no, Dr. Easterling may have a better.
I'm not sure if he's on. Dr. Easterling, you're here? I think he had a hard break. Oh,
really? Okay, no problem. So say the question again.
What's the biggest difference between the two vaccines other than the timeline between the first and second dose?
The method of vaccine, how it produces antibodies is exactly the same. The only difference is Moderna vaccine can be stored in refrigerated temperature. Normally, you can store it in refrigeration, whereas Pfizer needs a very deep freeze, like -70 degrees, that is like 94 degrees Fahrenheit temperature. So that makes the logistics of carrying the vaccination from place to place very difficult, because we need those kind of refrigerated containers to do that. So what the present situation is, people say that in rural areas where you are really have to vaccinate, or in the nursing homes and other places where you can't really have the containers, it will probably be better to use a Moderna vaccine, because that can be stored on refrigerated temperatures as opposed to Pfizer. Otherwise, the people have done a good job of mobilizing the deep freeze boxes to be able to transport it across the country. You actually saw that. Even in the middle of snow, people were able to transport the vaccines to the places they want to get it.
Great, thank you. Do you have an estimated date when the vaccine will be available to the public in New York City? And will clergy be given some kind of essential status?
Oh, I would defer to Dr. Easterling, because I'm not speaking for the city, so I just don't want to speak out of turn. So
yes,
Yeah,
thank you. We can find out the answer to that
let's
question
find
and
out.
share it later.
No problem. Go ahead, Ryan.
Finally, yes, this webinar is being recorded and it will be shared through the Borough President's communications with the community. We're going to be putting out an e-blast later today or over the weekend with all the information.
Go ahead, Ryan. Okay, so as we get Ryan queued up, does anyone from the panel can give us any information in Spanish? Ryan?
So
okay, go ahead.
Yeah, so why do you suppose this vaccine was engineered the way that it was and not like most of the weakened strand of the virus?
I'm sorry, Ryan, can you say it again?
Why do you suppose this vaccine was engineered the way that it was and not like most with a weakened strand of the virus?
Because I just don't want to get too technical, because the messenger RNA, right, which is a signaling system, right, in the cell, that's a signal. The cells is like a flag. Whenever the messenger RNA is like a flag waver. So there have been that has been looked upon as a possible way of inducing antibodies to that, has been tried in the past, and this is the first time it was used extensively, able to show the signaling mechanism instead of just injecting a. Normally, sometimes we inject a virus which is inactivated.
We need to up that then.
Yeah, that's what we're
I'm sorry.
Hold on.
Somebody is there?
No, go ahead. I think that Ryan was in the
Okay,
back.
so that's the reason. So this is a very highly sophisticated technology by messenger RNA. That is one of the reasons why it also been done much more quickly than the regular vaccines.
Yeah, the question about the more information in Spanish, I think that as we go along, we will definitely have multiple languages in terms of a quick cheat sheet for different languages as well. But today is just only in English. Ryan, you back?
I'm back. Sorry about that. Another question we have, can someone provide some general guidance on the difference between illness antibodies and vaccine antibodies?
It is a little more common, because antibodies are multiple ways. Some antibodies are what we call neutralizing antibodies. In other words, they don't kill the virus, they just neutralize the effect at some point, right? And what we are seeing is sometimes after the infection with the COVID, you just develop a neutralizing antibody that is not effectively kills the vaccine, but it basically neutralizes its effects. So what COVID is providing antibodies, we believe that it creates antibodies which will, when the COVID comes in, virus effectively comes in after you get immunized, it is going to go after and it is going to kill it by what we call as a T cell, which is a special cell we developed in the body due to vaccination against the COVID virus, so that it is more specific, able to deal with it.
Thank you. What are some side effects from this vaccine, some common side effects?
As I said before, you may feel a little feverish, you may feel a little pain at the side, or you may feel a little weak and tired. And people say that is more with the second dose than with the first dose. First dose, usually people do have very minimal symptoms, but second dose may require, you have more symptoms. And in some test population, they may have to take actually, what do you call it, a day off after the second vaccination. But we will see how it works out in New York City, because the people are very different in different parts of the country. So we have to see how it is. But having, again, the most important point is having a little reaction is normal. I don't think that is not nothing to be frightened about. That is perfectly normal. Of course, if it is really big fever and you start having chills and things and all an allergic reaction, then that's very different. But normal reaction of feeling a little feverish, under the weather after the vaccination is perfectly normal.
Great, thank you, Dr. Raju. I am looking for other questions. I don't see any other questions, but if there's anything else, Pastor, do you want to
I think there's a question directly to me. It says that if client experiences a mild allergic reaction on the first dose, do you still give them the second vaccine with caution?
We are waiting for CDC to finally opine on that, so we will make a decision on that.
Ryan, did you ask a question from the charter school?
Yes, I did. Yes, I did.
Okay. I think you have some more new questions, Ryan.
If you get an allergic reaction, are you at all immune?
No.
Can you expand on that? What does that mean?
That means that you're not, the allergic reaction not to the antibodies you're developing. The allergic reaction is to the injection you are getting. That immediately happens as soon as you inject the person, you develop an allergic reaction. That is not because of antibodies, right? Because antibodies take time to develop. So this is basically to the injection itself, what is contained in the injection. So that an allergic reaction after the first injection does not mean that you are immune to the COVID virus.
Yeah, I think also too, I think that yesterday there was a news report that the president-elect Joe Biden said that it's not mandatory to be given to all residents. There's a question that has here. I think that Dr. Easterling is back on. We want to know two things. Number one, is it mandatory for students? Is Dr. Easterling back on? I think I saw him. Yeah, Doc, could you respond to that? Could you unmute him for me, please? Give us 1 minute. All right, there you go.
Great. Sorry, I had to jump off and join a City Hall call, but yeah. So the first question, or I guess question around vaccines being mandated. So I know that there has been some conversations that have been happening. To date, there have been no decisions around mandating any vaccines. I think, it's going to be really important. And what I know, at least in our conversations here in the city, is that we're leading with trust and transparency, because trust is going to have to be at the core of turning a vaccine into a vaccination. So there are no groups that are being asked to be mandated to take a vaccine at this point. I cannot say in the future if that's going to change, whether an employer will make that decision or how we're going to integrate this into our routine vaccination schedule. Because again, we do not know yet long-term effectiveness. But where we are right now, we have a limited supply of vaccines. They're going to long-term care facilities and healthcare workers. No one is mandated to take the vaccine. We need to address hesitancy head on. We need to acknowledge both historical and contemporary injustices, as we know that this is partly why we're experiencing a lot of hesitancy, but also sharing the information around the science and data people really understand how the vaccine was developed and really went through a very thorough monitoring protocol. But as far as mandating vaccines, no, that is not a decision that I understand that anyone in New York City is doing.
Thanks, Dr. Easterling. There was a question earlier that when you were off about when the vaccine would be available to the more general public and whether clergy would be considered essential in that prioritization.
So what I can say is that as we have been working both at the federal level and the state level to understand how prioritization is going to be assigned to essential workers. Again, the list of essential workers is long, and we're certainly working with the state to really understand how that is going to roll out. I cannot say at this time how the prioritization will be assigned or allocated to essential workers, or if even clergy is included on that list. But we've certainly been having discussions with the state. We're still waiting for recommendations at the federal level, which we do hope will come out this week. I think once we have the recommendations at the federal level to sort of allocate prioritizations to the next groups, essential workers being one of those groups that we should get additional guidance on, then we will work with the state to really begin to think how we're going to operationalize that at the local level. So I think that there is some opportunity. One of the things that we have done just to be proactive is that we've partnered with the New York Academy of Medicine to really work with New Yorkers to inform our equitable prioritization process, especially essential workers assignment. And so we asked really two questions. One, should an occupation based on the data really receive prioritization for the COVID vaccine? And then how should we take into account other factors such as age, neighborhood, race, ethnicity, and the impact during wave one included in our prioritization process? Because again, the federal government is really providing guidance. Usually those guidance, providers, state officials, we follow those guidance, but we do have some opportunity to think about how we're going to roll that prioritization out as well. So we're using the information that we've gained. We have been working with, again, NIAM, but we've recruited across all 5 boroughs. I participated in all of the sessions to really charge the group, but also to hear from them why New Yorkers are joining this process. And it's really been powerful to hear from New Yorkers about why they're contributing their time to really help New Yorkers receive an equitable allocation.
Thanks, Dr. Easterling. What type of information will people have to provide when vaccinated? I think this question's coming specifically about concerns for the undocumented immigrant population.
Yep, no, that's a very good question. And I think we're going to have to do a lot of messaging and education around this. I mean, it's going to be similar to, the testing services that we have been providing to test and trace and during this pandemic. I think it's really going to be about access. And so identifying the locations that people trust. We're really working with the sites that people go to now for their vaccinations, providers and pharmacies, urgent care centers, and community clinics. And I think that's going to be important because as you interface with those already existing infrastructures and existing structures, they already have information, you already know them. It's not about sharing additional information at all. It's really making sure that they're able to do their assessment and receive the vaccine. And I'm sure that there will be additional guidance, maybe some additional screening questions that may be implemented to make sure that you can think about anytime you receive a vaccine, there are questions around allergic reaction, anaphylaxis reaction, or anything of those questions. And we know that those will likely be integrated into a screening or physician interview. So likely things that will likely be required, at the very least, name and being able to follow up with that person, because everyone should be receiving their vaccination card, especially those who are receiving the Pfizer and the Moderna vaccine, since it is 2-dose, and there's going to be a vaccination card that the person will then be able to make sure that they can schedule for their second dose. If they're going to a provider, or pharmacy, sure, they will ask for health insurance. But if the person does not, it is not going to be a rate limiting step to receive the vaccine. Certainly, a lot of institutions often ask for ID, and I think we have to be clear that the ID is also not a rate limiting step, but really just to make sure that we're able to capture information. One of the things that we've been thinking about in our equity strategy is access and uptake, but specifically outcomes. And our outcomes have to align with our intentions. And if our outcomes are really to minimize population differences, and we really need to know that we are vaccinating individuals specifically in priority populations. And so being able to capture not only name, but also race, ethnicity, and age, gender, in all categories are going to be super important. So we can be transparent about who's really receiving the vaccine.
Thanks, Dr. Easterling. I think this question was answered earlier, but I'm going to re-up it again just real quick. If you had COVID already, are you immune to the virus?
If you had COVID already, I'm sure Dr. Raju had mentioned this. Certainly, the expectation is that anyone, even if you had a previous infection, the expectation is you're still going to get vaccinated. There's just not a lot of information that we know about the virus, and so about really having natural protection, and so really having receiving the vaccine is going to be important. Now, can we use this information as a way to think about prioritization? And I know that some of the healthcare systems have been thinking about this and been messaging to their healthcare workers that if they were previously infected, well, maybe let some of your other colleagues and coworkers get vaccinated first, so that they do not get infected and maybe more at risk at this very moment. But the message is still that they want everyone in those settings to get vaccinated. So it's really just about the guidance that we're using. But I think the key things is that even if you had a previous infection, the expectation is you're still going to get vaccinated. And if you have an active infection, then that you should wait till your active infection has been completely resolved, meaning that you are finished with your your isolation, and that you no longer have symptoms.
One question here that was posted twice, according to this note to me: since the vaccine is still new, will the city be tracing vaccinated individuals for data and safety?
Just let me make sure I understand the question. Will the city and state be tracking the safety and monitoring if there are any adverse events?
I'm not sure. It just says
Okay.
that will the city be tracing vaccinated individuals for data and safety?
Okay. All right. Well, I'll assume that I heard the question the way that I restated, but if the person can unmute themselves and let me know if I heard it wrong, please let me know. Yes. So just so you understand, and I think it's always, I want to over communicate, and even though that the question is asking something specific, just so you know that during this entire process, we've been tracking all individuals who've been part of the clinical trials, right? There are 5 phases. There's a phase 0, and then there are 4 phases in the clinical trials. Phase 5 is really continuing to monitor those individuals after phase 3, now that once the vaccine has been approved. And so we have the Pfizer vaccine that is approved for emergency use authorization. So through the vaccine adverse reporting system, which is a system led by CDC and also the Food and Drug Administration, we actually have a number of different ways where we can track any adverse events that may happen, both at the city level and the state level. So we can actually receive the data from the vaccine adverse reporting system to be able to monitor if there have been any side effects. And of course, also through our infrastructure, we do have a citywide immunization registry as well, which we have had in place for quite some time, for decades. And we also can leverage that reporting system as a way to, one, know who the vaccine was administered to, who administered the vaccine, and if there were any concerns or issues. So there are certainly a number of different mechanisms for us to gather that information.
Thank you so much for that. Any closing comments, Dr. Raju?
No, I think again, thank you for organizing such an important meeting, and it has been good. So again, there's a lot of these questions will be, we'll continue to answer them, and we just want to make people feel safe and comfortable with this idea of getting vaccination. So only an education can really get us out of this. So I'm sure that as very strong New Yorkers, we will definitely put an end to COVID hopefully by middle of next year when we have an effective vaccination going on. Again, thank you for this great opportunity and thank you for being a part of this.
No, thank you. Thank you, Dr. Raju. Thank you, Dr. Easterling. Thank you, Ryan Lynch, Chief of Staff. Thank you, Mike Mutal. Thank you, Jeff Lowell. Thank you, David Perez. I want to thank Assembly Member elect Ms. Zimmerman, who is on. Thank you to all our speakers who is also on as well, who participated today. As Ryan Lynn said, that we will have this on social media, and so that the information can be carried over to you. If you'd like to reach out to us, don't forget that I think I put my information in the chat. If you receive an email from us, you can always respond to the person that you received the information from. I trust and pray that you're all going to be safe this weekend. Stay warm, do the best that you can do. Wash your hands, wear your mask, and make sure that you follow social distancing room. Dr. Easterling wants to get back in. Go right ahead. Could you unmute him? Thank you.
Yeah, I just want my closing comments to just also overemphasize how important this historic moment. We're only going to be successful if we do this collectively. The three things I just want to say is that, like this space, I think we're going to have to continue to convene coalitions and groups and bring more information. And so how often I need to be called, I am going to make myself available. Two, we also want to train you all as the trusted messengers. And so we are preparing that training, and we will get that information to you as quickly as possible. And then three, as we have accessible plain language collaterals available, pamphlets, videos, presentations, we will let you know as soon as they're available. That's it.
So yeah, thank you all. Thank you for your work, sir. Doctors, thank you again. Take good care, everybody. Thank you all, and have a good weekend.
Thank you. Be well.